I'm Dave Turpin, the Interim Editor-in-Chief of the AJO-DO. I'd like to welcome you to the journal and our Case of the Month. In this short video, I will show selected pretreatment records of a case report that was accepted for publication in this month's issue of the journal. After you review the author's treatment options, I want to know how you would manage the treatment of this patient. In the initial examination, this Chinese girl was 15 years of age with no growth expected. Her Class 1 malocclusion was characterized by congenitally missing mandibular central incisors. Pre-treatment facial photos show a well-balanced symmetric face with normal vertical proportions. The anterior overbite is deep, with maxillary incisors overlapping the lower incisors by 50%. Anterior overjet is 3 mm, and the mandibular midline is 1 mm to the left. There is 5.5 mm of anterior crowding, and the mandibular central incisors, as I indicated, are missing. The study casts show a Class 1 molar relationship as well as the mild maxillary crowding. From the cephalometric radiograph, one can see a Class 2 skeletal relationship with a low mandibular plane angle. No obvious skeletal asymmetries are present. 3 treatment alternatives were considered in the treatment of this patient. Option number 1, space opening in the mandibular anterior area to provide room for fixed dentures or implants to replace the missing central incisors. With this plan, an ideal Class 1 molar relationship could be achieved. Option number 2, extraction of the maxillary second premolars and retraction of all maxillary incisors to maintain a Class 2 molar relationship. This option would result in the loss of 2 healthy teeth as well as the likely Bolton tooth size problems. And we have option number 3, anterior movement of the entire mandibular dentition to obtain an ideal overjet and overbite relationship. This plan would lead to a Class 3 molar relationship post-treatment. Just how stable would this newly acquired relationship be long-term? Which one of these treatment options would you choose? Allow me to give you a sneak preview of the patient following appliance removal. The majority of the anterior-posterior change in the dentition was the result of using a Forces FRD fixed functional appliance for a period of 6 months. I think you would agree that the patient's profile and facial aesthetics were maintained. Post-treatment follow-up records were gathered at 6 and 42 months to verify long-term stability. Limited compromises in the occlusion and dental midlines were noted long-term. To find out more about how the authors treated this patient, click on the link below to view the AJO-DO Case of the Month on the journal website.